Postoperative Vaginal Cuff Evisceration and Management, a Simulation Training by Dr. Lauren Segaria and Dr. Derek Ballas. Vaginal cuff dehiscence and evisceration is an uncommon surgical emergency, occurring at a rate of 1 to 4% of all hysterectomies. 35 to 67% of cuff dehiscences are complicated by evisceration. Vaginal cuff dehiscence can occur at any time postoperatively, with the average time of 6 weeks to 1.6 years. Herniation of the small bowel and distal ileum are the most common intra-abdominal contents found during evisceration. Bowel necrosis can occur in 30% of these cases. During training, some learners may never be involved in caring for patients with this medical condition. The lack of experience may lead to delayed recognition and inappropriate treatment. Learners were put through a simulation and debriefing as a tool for reinforcing traditional didactics about vaginal cuff dehiscence and evisceration. Objectives of the simulation included evaluation of a postoperative patient, evaluation and management of vaginal cuff dehiscence and bowel evisceration, and performing the appropriate surgical interventions. The personnel needed to perform this simulation include the Noel simulator as the patient, a nurse, and 2 learners. Additional supplies for the simulation include the Noel simulator modified with a vaginal cuff, simulated bowel, laparotomy sponges and normal saline, laparoscopic repair equipment, and vaginal repair equipment. The supplies needed to create the vaginal cuff include dragon skin, parts A and B, silk pig paints, a plastic bowl or basin, and a scalpel. To assemble the vaginal cuff, mix 30 cc's of dragon skin part A with 30 cc's of dragon skin part B. Stir together. Using a Q-tip, add a small amount of silk pig flesh-colored paint to the dragon skin mixture and stir. Allow to cure at room temperature per product instructions. When dry, peel the mold out of the bowl. From this mold, you will create the vaginal cuff. To create texture, again combine 30 cc's of dragon skin part A and 30 cc's of dragon skin part B. Add a small amount of silk pig blood-colored paint and stir. Apply to the vaginal cuff to add texture as desired. If needed, pin to a flat surface to keep the vaginal cuff from rolling on itself. When dry, trim the dragon skin mold to a size that will fit the vaginal opening of the model pelvis. Then, using a scalpel, cut an ellipse in the center of the mold to create the opening of the cuff. Secure the cuff to the model pelvis. In this case, suture was used to reinforce the cuff's placement in the model. Suture allows for secure placement without injury to the model. To create the bow, you will need 1 container of instant rice, 1 package of pork sausage casings, 2 cups of chocolate pudding, a handheld sausage stuffer, and silk pig paint. Start by cooking 4 cups of rice per the package instructions. When finished, allow to cool completely. Then stir chocolate pudding into the rice to add color. Next, thaw the sausage casings per the package instructions. Once thawed, place 1 sausage casing over the tip of a handheld sausage stuffer. Fill the barrel with the rice pudding combination and twist the handle to fill the sausage casing. 3 to 4 strands of bowel will be needed for the simulation. Silk pig blood-colored paint is then applied to the outer surface of the stuffed sausage casing. 1 loop of bowel is then placed in the vaginal opening of the Noel simulator to be used in the simulated patient scenario. Additional strands of bowel will then be used for the laparoscopic abdomen. To set up the laparoscopic abdomen, place 1 loop of bowel through the created vaginal cuff and place the additional strands in the abdomen. The model should then be set up in an operating room setting. To run the simulation, learners are given a case of a patient postoperative from a hysterectomy. Learners should then proceed to evaluate the patient and recognize the vaginal cuff dehiscence and evisceration. Learners will then need to manage the patient in an emergency room setting before moving the patient to the operating room for surgical reduction and repair of the vaginal cuff. In the operating room, learners will choose their route of repair and simulate the reduction of bowel and repair of the vaginal cuff. During evaluation of the patient, learners should obtain a complete history of present illness, past medical and surgical histories, and complete a physical exam, including speculum exam. On spiculum exam, learners should look for organs, lacerations, and bleeding, and the entire vaginal cuff should be visualized. Following recognition of evisceration, attempts should be made to reduce the herniated viscera. When unsuccessful, the intra-abdominal contents should be wrapped in moist gauze and the patient moved promptly to the operating room. In the operating room, learners will choose their route of repair. They should reduce and evaluate the eviscerated bowel, looking for any signs of necrosis. Learners can then practice repairing the vaginal cuff. Following completion of the simulation, a post-simulation debrief can be performed as a way to reinforce learning. During the post-simulation debriefing, instructors can review preoperative considerations, risk factors for vaginal cuff dehiscence, patient presentation, surgical techniques to both decrease the risk of dehiscence and techniques for repairing the vaginal cuff, as well as patient counseling on the risk of vaginal cuff dehiscence and evisceration. In summary, vaginal cuff dehiscence and evisceration is an uncommon surgical emergency. Simulation of this uncommon event can improve learner knowledge and confidence in managing these patients.